Okay, so my project is the effectiveness of smart inhalers versus regular inhalers. Introduction, purpose, aim. Technology in nursing is changing fast, and that is why we have to keep up with the new innovations coming. Smart inhalers is the future for people with COPD and asthma, but before expanding into more countries, they are ensuring that these smart enabled care pathways deliver the best outcomes for people. Smart inhalers are designed to help ensure patients are taking their medication as prescribed by recording the timing and dosage taken on their smartphone. Studies are being conducted in the UK and in Barcelona, Spain, making sure they will be safe, timely, effective, efficiently, equitable, and patient-centered care. This is a study that is very important and should take into consideration because it would help COPD and asthma patients to effectively and efficiently use the smart inhaler with an app on the phone telling the patient when the smart inhaler is properly positioned to give the proper dose, more accurately than a regular inhaler. Dosage taken will be in the records of the app, and not only can the patient see it, but also the healthcare provider that is working with that patient. It saves money and time for the patient from the frequent clinical appointments and also saves time, and the healthcare provider can monitor patients' readings from the app. So my research questions: in asthma or COPD patients, how does a regular inhaler compared to a smart inhaler affect reliable data within the healthcare system setting? In asthma or COPD patients, what is the effect of regular inhalers compared to smart inhalers on proper use once the patients are home? And this was a study of adherence with smart inhalers versus regular inhalers. The population was 1,009 patients with asthma and COPD. For the smart inhaler, which is the electronic inhaler device here, only had asthma patients, and they were only 99 out of the total 1,009. They used a total of 194 investigators, from 139 were from pulmonology, allergology, and primary care centers participated in the study. The study was between March 2013 and March 2014 in Barcelona, Spain. And the results were, although there was only 99 smart inhaler device group, the smart inhaler device showed higher rates of adherence towards the healthcare providers. And this is just a picture quick of the patients used, and these are the tests they took. You could see asthma history, spirometry, asthma control test, the Morisky Green test, and you could see that the smart inhaler added smart inhaler records, which is in the app. So smart inhalers. These monitoring devices attached to the user's inhaler and should ideally be able to monitor adherence, accurately record the time each dose is taken, store data, not interfere with the dose of delivered medication, and provide access to data so that it can be downloaded to a personal computer. Benefits range from improving medication adherence to reducing hospital admissions, which makes smart inhalers the next wave of respiratory care technology to improve patient outcomes. Patients appreciate the smart medication reminders, personal insights, and automated communication with their doctors about what's happening between the visits. The features and benefits of the Propeller system, which is one of the companies that make the smart inhalers, have resulted in improved disease control and are greater than 70% reduction in rescue inhaler use on average across diverse clinical settings, patient populations, and studies, according to Van Sickle, CEO of Propeller Health. These are just some trials by Adherum. The inhaler sensor was shown to improve adherence by up to 59% in adults and 180 in children with asthma. An additional study of 220 children between the ages of 6 and 15 years showed that 84% of the young participants with a reminder inhaler took their medication, compared to the 30% without that technology. which I thought was obvious that the smart inhalers are definitely better than the regular inhalers. Garth Sutherland, CEO of Nexus 6, explains that there's a real need for this type of technology, in particular because of the doctors not having visibility on how patients are using their medication. If you are wondering why Garth Sutherland is talking about this, is because the Nexus 6 was actually used in the studies for the smart inhalers. So the graph, this is just a graph of the study, and you can see here that the darker one is the smart inhalers, and it's a higher percentage in the adherent group, and you can see that the non-adherent groups are higher in the regular, using the regular inhalers. So that means that they are not either taking the medication, or the doctor just can't get reliable data from the patient whether they took it or not, or stuff like that. Smart inhalers and insurance coverage. The Centers for Medicare and Medicaid Services had added the Chronic Care Management Code, which is providing ways to reimbursing organizations that manage chronic conditions through technology. This was effective January 2015, and it has begun reimbursing qualified practices from non-face-to-face monitoring of patients with chronic diseases that suffer from 2 or more diseases, making it relevant to many asthma and COPD patients. With this recent development, it may be easier for patients to have smart inhaler technology paid for by their insurance provider in the future. So that is nice. We'll move on here. These are just another percentage results, which shows that the smart inhaler is shows greater results than the regular inhaler. So I think this is why it's important to keep up to date with new technologies as a nurse coming in the healthcare field, to know how to use the devices and teach the patients that will need them. Training provided to nurses on how to use new products is very important. Understand the change and importance of using a smart inhaler versus a regular inhaler. We have seen in the studies that smart inhalers have more reliable data, because the doctor can practically see all the data, how he took the medication and everything through the app. Knowing the coverage of Medicaid and Medicare for these devices and providing information to patients with asthma and COPD or other chronic conditions is important. Making sure to have structured recording of patient health information, access to care management services, and coordinating and sharing patient information with practitioners and providers to ensure the patient gets benefits and they get paid. No studies are to take years. This study was conducted in 2013, and it's been a while, and we are still unaware of when the smart inhalers will officially be released. But I did find an article from the Pharmacy Times that mentioned that the world's first smart inhaler was approved already by the FDA this year. These smart inhalers will provide us with reliable data that we didn't have before. As nurses, we can assist the healthcare provider with monitoring asthma and COPD patients from home. And that's it. And these are my resources. Thank you.